The World Health Organization says a series of new Ebola treatments will soon be sent to West Africa as the death toll from this disease continues to rise.
With more, we turn to Paul Yee at the News Center. Paul, the UN agency on Tuesday laid out a new battle plan in the fight against Ebola. It says vaccine trials may begin in the worst-hit countries across West Africa as early as January.
That's right. The plan first involves applying a special serum made from the antibodies of surviving Ebola patients within the next few weeks. And a batch of experimental vaccines will hit the continent next year for what officials are calling real-world testing. Our Connie Lee has the details.
A serum made from the blood of patients who have recovered from Ebola could be available in Africa within weeks. According to the World Health Organization, the serum, which would contain Ebola antibodies, would first be sent to Liberia, one of the worst-hit nations, to treat new victims of the virus. Marie-Paul Kinney of the WHO also said that a vaccine could be ready by this January to combat the outbreak that has already killed more than 4,500 people. This hopeful news comes amid some new restrictions in the United States. The U.S. government announced on Tuesday that starting Wednesday, travelers to the U.S. coming from the nations of Guinea, Liberia, and Sierra Leone must fly into one of the 5 designated airports in the cities of Chicago, Atlanta, Washington, Newark, New Jersey, and New York City. All travelers, even U.S. citizens who spend time in any of the Ebola-stricken nations, will go through an enhanced screening process for the virus. People in the U.S. seem pleased about the new restrictions.
I think that sounds like a good idea because for those 5 designated airports, they can certainly set up the proper medical facilities.
That's how you control it. Those are the people that are coming in. You know where they're coming from, not where they're not coming from.
So far, 3 people have been diagnosed with Ebola on U.S. soil, 2 of them healthcare workers. Connie Lee, Arirang News.